So we'll start our next video. Second video. The case is about GIT related ulcer. Case 1 is ulcerative colitis. So colitis. So patient come with you with bloody diarrhea. What we are gonna do? We order the baseline test, CBC, BMP, physical examination, stool for our parasites, stool for white cells. It can be inflammation, it can be bacterial infection, it can be viral infection, parasitic. Stool for bacterial culture, stool for white cell, or parasite. We have to order LFTs. Maybe it's like a bleeding due to liver disease, PTINR, maybe coagulopathy, and ESR to rule out IVD. Then we will send the patient home, and in a week we will see the patient results. We will see in the result only ESR is elevated, then we will order sigmoidoscopy and rectal biopsy. And with the result, we will advance to obtain the result. Ulcerative colitis is confirmed. Bring the patient back to office because we have sent him to a home. Then we will prescribe him mesalamine. If he has diarrhea, lopramide. For antispasmodic, we can add diazoclamide, dietary consult, and counseling. Then we will send the patient home, schedule an appointment 2 weeks. So the case was of ulcerative colitis involving rectum and sigmoid. So the treatment line was topical 5-ASA, antidiarrheal, antispasmodic, dietary ESR. Okay, so that was the case about ulcerative colitis, but mild. Next case is about irritable bowel syndrome. Irritable bowel syndrome. So how this case irritable syndrome. In this, if a patient comes with diarrhea, then you will order the same test like CBC, BMP. Now, diarrhea can be caused by DSH. It can be, we have to check if it's bloody or not. Fecal called bleeding test. Same stool over parasite, stool for WBC, stool bacteria culture. Now, if it's diarrhea, then it can be due to pancreatic, so 70 or stool fat test. If he's a woman, the baseline we can do pap smear also. In 1 week, we call the patient. Patient arrive for the appointment. We will ask him. We will give him lactose-free diet, high fiber diet because all the tests are normal. Lactose-free cause irritable bowel syndrome is a diagnosis exclusion. High fiber diet, dopamine, biofeedback, reassurance, relaxation exercises, relaxation, patient counseling, exercise, advice to drive with seatbelt. And because seatbelt is because the number one cause of the mortality is seatbelt, we have to save sex seatbelt. We have to give this information to or alcoholic if is smoking. Schedule appointment 2 weeks. So it's a irritable bowel syndrome, and you have to order these things. Irritable bowel syndrome ki journal approach. What is the journal approach? We have to do Diet modification, high fiber, lactose free, avoid fusions producing foods, reassurance, patient education, good physician patient relationship, behavior therapy for symptoms associated with stress, and pharmacological treatment, antispasmodics for abdominal pain like taclomine, hosacamine, antidiarrheal loperamide, TCA because it can be mentally, amitriptyline, benzos for severe cases, behavior treatment, psychotherapy, biofeedback for associated stressors. We can do that thing. Next case will be of constipation. If a patient is coming with chronic constipation, so what we're gonna do is we're gonna order the same test like CBC, BMP. We have to order same magnesium phosphate level in this patient because of constipation. Uh, PSH, if he has a history of diabetes, then HbA1c, big color bleeding, colonoscopy, if the age of and we give him Salium, yeah, Metamucil, and then we counseling, send patient home, schedule appointment in 1 week. Patient symptom improve, then it will be good. We have to give him diet approach, high fiber diet, metamucil, oral hydration, low salt diet, low fat diet, exercise program, patient counseling, therapy should be initiated pending lab results. So we have to start the therapy. Any other tests for the constipation? I think these are the enough tests we have to do. Thyroid, diabetes, occult bleeding, GI disorders, colonoscopy, magnesium phosphate, selenium. Okay. So what we can do for constipation? We can give patient education, initial increase for fiber intake, bulk forming laxative, psyllium, methyl cellulose, or milk of magnesia. Avoid constipating medication like narcotics, calcium channel blocker, anticholinergics. If patient do not respond, then consider other class of laxative like softeners, Doxate, osmolar agent, lactulose, sorbitol, magnesium citrate, and stimulants, Sina, Bazacodol. Disinfect in cases of fecal impaction. Consider further diagnostic. If patient doesn't improve, then we can do clonic transient study, anorectal manometry, and pelvic floor study. So we can do all these things also. So here our scenarios for GIT will end.